I'm Dr. Dralos. This is a lecture on terminology of the urinary system. The urinary system removes waste, regulates blood volume, blood pressure, and blood pH, and controls the levels of salts in the blood, including sodium, potassium, and calcium. Nephrology is a medical specialty that focuses on the kidneys. The word comes from the Greek nephros, meaning kidney, and logi, meaning study of. Urology is another medical specialty that focuses on the urinary tract as well as reproductive organs. This comes from Greek ouron, meaning urine, and logi, meaning study of. We will now briefly review the anatomy of the urinary system. First, on a large scale, we have the anatomy of the kidney. The renal capsule is a tough fibrous sac that surrounds the exterior of the kidney. The renal cortex is the outer part of the kidney between the capsule and the medulla. The medulla is the innermost part of the kidney, split up into different sections called renal pyramids. The tip of each pyramid is a papilla. The renal calyx, plural calyces, is a chamber that collects urine from a pyramid. The renal pelvis is a dilated part of the urethr, which you can see here in the drawing, that funnels urine from the major calyces to the urethr. The renal hilum, also known as the renal pedicle, is the central location where the urethr as well as blood vessels and nerves pass through. The urethr is the tube through which the urine flows from the kidney to the bladder. Thus, the overall flow of urine goes from the nephrons to the renal pyramids, to the papilla, to the calyx, to the pelvis, to the urethr. Now, we'll talk about microscopic anatomy. The nephron is the functional unit of the kidney. It is composed of the renal corpuscle and the renal tubule. The renal corpuscle is a blood filtering component of the nephron. This includes the glomerulus, which is a ball of capillaries at the beginning of the nephron, and Bowman's capsule, which is a capsule that encloses the glomerulus. The renal tubule includes the proximal collecting tubule, the loop of Henle, the distal collecting tubule, and the connecting tubule. Many different functions of the kidney occur in the renal tubule, including different functions related to salt and water balance. The blood supply on a small scale includes afferent arterioles, which are small arteries that go into the glomerulus, and efferent arterioles, which are small arteries going out of the glomerulus. This is a diagram from Wikipedia showing some of this microanatomy. I'll now briefly touch on key hormones of the urinary system. Aldosterone is a hormone that is produced in the adrenal gland that helps to retain sodium and acts in the kidney as well as other organs. Aldosterone affects blood pressure, sodium, and potassium levels. Antidiuretic hormone, also called vasopressin, is a hormone produced in the brain that increases water reabsorption to keep more water and constricts arterioles to raise blood pressure. Parathyroid hormone is a hormone produced in the parathyroid glands that regulates calcium levels through effects on the kidney and other organs. Now we'll go through different routes. The number one route related to the urinary system is uria, which comes from the Greek ouron, meaning urine. This slide has several different examples of this route in urinary system terminology. First, there's the word urination. Uremia refers to elevated urea in the blood. A urinalysis is a laboratory test of the urine. Albuminuria refers to excess albumin in the urine. Albumin is a protein in the blood. Anuria means the state of not producing urine, coming from the root an, meaning without, so without urine. This can be seen in end-stage renal disease. Dysuria is painful urination and includes the root dys, meaning bad or painful. Enuresis is nighttime loss of bladder control or bedwetting. Glycosuria is sugar in the urine, which can be seen in diabetes. Hematuria is blood in the urine. Ketonuria is ketones in the urine. Nocturia is the need to get up at night frequently to urinate and includes the root noct, meaning night. Oliguria is production of abnormally small amounts of urine and includes the root olig, meaning few or little. Polyuria is the opposite, production of abnormally large amounts of urine, including the root poly, meaning much or many. Proteinuria is excess protein in the urine. Therefore, albuminuria is a specific type of proteinuria. Pyuria is pus in the urine and includes the root pi, meaning pus. Now we'll discuss additional roots. The root azot means nitrogen or urea and is the root of azotemia, a condition where there are elevated nitrogen-containing compounds in the blood. Cyst means bladder or sac. Cystitis is inflammation of the bladder, usually caused by an infection, while cystoscopy is a procedure to look inside the bladder with a camera. Glomus means ball of yarn or ball-shaped mass. This is the root of glomerulus, which is the ball of capillaries at the beginning of the nephron that we saw in an earlier slide. Lith means stone. Nephrolithiasis is the term for kidney stones. Micturier means to have the urge to urinate, and is the root of micturition, which is another term for urination. Neph means kidney. This is the root of nephrology, the medical specialty focused on kidneys. Nephron, the functional unit of the kidney, and nephrectomy, which is surgery to remove a kidney or part of a kidney. Pile means pelvis or kidney. For example, pyelonephritis, which is inflammation of the kidney as a result of infection. Rene means kidney, for example, renal, relating to the kidneys. Tripsy means crushing, for example, lithotripsy, which is a procedure to break up kidney stones with shock waves. Urethr means urethra, for example, urethritis, which is inflammation of the urethra. Vesic also means bladder, for example, vesico-ureteral reflux, which is abnormal flow of urine from the bladder back up the ureters. Normally, urine should flow from the ureters into the bladder. Here's some additional vocabulary. Dialysis is a procedure that removes waste and excessive fluid from the blood using a dialysis machine. A diuretic is a substance that promotes increased urine production. Frequency means urinating more often than normal for a patient. Hesitancy is difficulty initiating urination. A KUB stands for kidneys, ureters, bladder, and just refers to an abdominal x-ray, which is sometimes also abbreviated AXR. Incontinence is the inability to control urination or defecation. Renal failure, also known as end-stage renal disease, is a medical condition in which kidneys can no longer filter waste out of the blood. Urinary retention is an inability to empty all the urine out of the bladder. Urgency is a sudden, strong need to urinate, and voiding is another term for urinating. These are some references. Thank you for listening to my lecture today.